Hi everyone, thank you for joining us today. I'd like to introduce Dr. Tom Cummins. Many of you know him. He's our Chief Medical Officer for UT Health East Texas and has been such a blessing to our healthcare institution. Has been leading the charge against COVID since the very beginning. Tom, I wish that I was inviting you here to talk about something else, but here we are, in another height of this pandemic. So just tell us what's different this time around than it was last time during this time this year.
Sure. So a couple of things are different. One is we do have a vaccine now that seems to help minimize the effects of the disease. But more importantly, we have a different variant that spreads faster, spreads farther, and is really affecting the younger people in our community currently.
I know as a practicing pulmonologist, lung doctor in the ICU, what shocked me the most is the number of younger, more healthy patients that are now on ventilators. What are your thoughts on that?
Yeah, we're seeing a lot of what I would describe as kids, people in their 20s. I can call those kids because all my kids are in their 20s. We're seeing people in their 20s and even early 30s that are on the ventilator, which is considerably different from previously.
So we know that the vaccine is safe and effective, and we're encouraging everyone to get it. Tom, what are your thoughts on the booster shot?
Well, I think the booster is going to be an instrumental part in continuing to decrease the effect of the disease. It's being recommended for people who are 8 months out from their second dose to give just that extra little kick that we need against the Delta variant. And I think that's going to play a really big part in helping quiet the pandemic here in East Texas.
You know, as physicians, I think that we both agree the science justifies, it proves that the vaccine works, it actually saves lives. How are our healthcare workers holding up during this difficult time?
Well, I mean, people are exhausted and we're working short. People are getting sick. Unfortunately, many of our healthcare workers didn't get the vaccine either, and so we have significant challenges across the organization in just meeting the needs of the patients with enough staff.
These are definitely times that I don't think we predicted and hopefully we'll never see again. If there's one thing that we could impart to you is that as vaccines save lives, please get your shot today if you have not already done so, and please wear a mask to help prevent the spread of this terrible virus amongst our population. One other thing we want to encourage you is that there's no reason to panic. We understand that the vaccine is safe and effective, and that if you have one and you wear a mask, there's little risk of anything bad happening to you. But we also understand that we need to remain compassionate during this time, as we have never seen what we're seeing right now in our hospitals and our ICUs. Tom, thank you for joining us today, and thank you to all of our healthcare workers and the front lines for doing what you do every day.